Hi, everyone. I hope you can hear me. My name is Carrie from Family Matters, and thank you for joining us today. We're going to go ahead and get started because it is noon. And so today we're going to talk about IEPs and data collection, and this webinar is being recorded and will be archived on the Family Matters website. So if you know of anybody who wants to watch it in the future, or if you want to revisit it, you'll be able to do that here in the near future. And I do want to say Family Matters is not a legal services agency, and we cannot provide any legal advice or any sort of legal representation. And so information received today from Family Matters is not intended as legal advice and should not be used as a substitution for that. So we're going to go ahead and just kind of dive into this. I will say if you have questions, go ahead and use the chat box, and I will monitor that today. So if you have questions, just type those in as they come to you, and I'll try to keep glancing at that and checking those. Okay, so every state has at least one parent training and information center. In Illinois, we have two. So as you see on the screen, Family Matters covers 94 counties in Illinois outside of the Chicago area. So in the map on the screen, there's a green blocked out area. FRCD is the Family Resource Center on Disabilities, and they actually cover the counties blocked out in green outside of our coverage area in the Chicago region. So if you are from that area or work with families who contact you from that area, you can always refer them to FRCD. But any county you see in white on the map are counties that Family Matters covers. So our contact information is all on the screen. So anytime you need to reach out, if you have questions more specific to your child or your situation, or have families you'd like to refer, don't hesitate to pass along our information or reach out to us. And so today we're going to cover IEPs and data, kind of talk about what data is, talk about IEPs, the importance of collecting IEP data, and improving data collection, things like that. So first, we want to talk about what data is. It's really important to understand what data is so we know how to use it. And data is really just factual information. It could be measurements or statistics, but it's information, factual information that's used as a basis for reasoning and discussion or calculation. We can use data in a lot of different ways. Data is very helpful, we said, in measuring progress, things like that. And we're going to really dive more into data, kind of what it is and how we can use that today. So I think really in our daily lives, we really don't think about how much we actually use data, but there are so many different ways that we can use data or do every day and just don't even really factor that in or think about it. Like I said, we may not give it much thought, but we use it in and out of our entire day. We use data when we manage or budget our finances. We're looking at, information. How much money do we have coming in? How many bills do we have to pay? Things like that. We're looking at a lot of different things. We check the weather, use data to think about planning trips. What's the weather going to be like? What when I'm get to where I'm going, and what kind of clothing do I need to pack, and regarding our health care, there's a lot of data that's involved in that. When you get test reports, things like that back, you're looking at data to help you make decisions. So data is used in cooking, all kinds of things. So really we use it all the time, and data is really a powerful tool. It's used to inform, engage, and create opportunities for individuals along their education journey and workforce journeys. And so we're going to talk about that as well. So, data, we use it day to day. We even use educational data. So if your child has an IEP, or just your child in general attending school, you gain a lot of data from education. So like we said, it's a really powerful tool that can be used. There are multiple forms of data that are collected in the educational setting, so we'll go over some of those. Formative assessments like small quizzes and assignments are given often, so we can gain data from small quizzes, assignments, look at those to see how a student is doing on those formative assessments. A lot of times data is collected when a student is exhibiting behaviors. So if a behavior observation is made, there should be data that is documented about those behaviors to try to look at, what's going on in that situation. So that's another area where you can gain data from. Projects, essays, and tests completed by the student are another area to show how that student's doing, maybe where they're struggling, what areas they have strengths and weaknesses in, you know, and show you if supports in place are working or not. There are more summative assessments like final exams and standardized test scores are another way. You can also look at cumulative records on a student, maybe their home life, give you data about that. And then even, you think about educational data, you might think just about what you gain from the school, but oftentimes parents of students with disabilities will gain data from evaluations or professionals outside of the school that student sees. So that's information that families can gather together and bring back to the school for part of the discussion. So, there really are so many different forms of data. Families can collect data as far as like looking at homework, how a student does with homework at home. So that's another piece of information that can be used. So I thought it would be important to talk about the IEP. An IEP is an individualized educational program. So once it's determined that a student meets the criteria to receive special education and related services, then the IEP or the individualized education program is developed specifically for that individual student. So an IEP is just a written statement of the educational program that's designed to meet that student's needs and is developed by the IEP team. So the IEP really includes a detailed description of what will be done to give a student the extra help that they need. So the IEP is going to change based on the student's needs. And an IEP is really just like a roadmap, and it's showing where that student is right now, but you're also determining where we want that student to go, where we want them to end up, what skills we want them to gain. So you're really looking at, creating a roadmap with that IEP, looking at where they're at currently and where we want them to be in the future. And so to determine that, you have to have data. Data has to be collected in order to determine what that student needs at any given point in time and determine, when changes need to be made. I also thought it would be important to talk about IEP team members, who's on the IEP team. There are a lot of different members that are on the IEP team. So you have a parent and the student. The parents and guardians are required participants of the IEP team, and then the student may attend and participate if the parent decides they should be present. And a student who's reached 14 and a half must be invited to the IEP meeting when transition is discussed. But I think it is important to note that a student can be invited to an IEP meeting at any age. Transition starts at 14 and a half, but if, it's important for a student to be there at a younger age, that can happen. And another member would be the general education teacher. So the IEP team must include a general education teacher who has knowledge of the curriculum and the provided interventions and that may be responsible for implementing the IEP if the child is or may be participating in the general education environment. You also need a special education teacher as part of the IEP team, and the special education teacher on the IEP team would be familiar with the provided interventions and responsible for implementing the IEP. And then the local LEA, or local educational agency, this person must know about the general education curriculum, be able to ensure that the IEP is being implemented, and have the authority to commit the resources. And then any evaluation personnel, when evaluation information will be discussed at the IEP meeting, those evaluation personnel would be present, who can explain the evaluation and or test results. And then you also have the right to invite others who have knowledge or special expertise about that student to the IEP meeting. But I mean, it's important to understand, you know, and remember that parents or guardians are required participants. And so it is important for parents to understand all of the data and have access to all of the data about that student. Because reviewing and understanding this data about your child or that student is going to allow you to participate equally in the IEP meetings and make informed decisions about your child or student's education. So it's also important to know, you know, you have access to this information. If an IEP meeting is being held, then at least 3 days before either an eligibility or an IEP meeting, parents must be giving copies of all of the written materials that will be provided either at the meeting, or they should be given, written materials that will be reviewed at either meeting, and be sent those like by mail, provided those in person, or another available method. So maybe email works for you, but you should get those records in advance of that meeting. That would include evaluation results, collected data, all of the IEP documents that will be gone over at that meeting. And as parents, you can request to review logs regarding the delivery of minutes of related services. So if your child's getting occupational therapy, speech, things like that, and you want to review those logs, you can make that request. You know, but all of these materials that are gone over at an IEP meeting are full of data, and parents and guardians, you know, you should receive those in advance of that meeting. And you know, if for some reason you find you're coming up on 3 school days, or it's 3 school days before and you haven't received those, you can always reach out to the school staff, maybe in writing, and just ask for those documents prior to the meeting, just so you have the chance to review those and really prepare for that meeting. And I think that also allows you to get ready for the meeting. If you have it triggers any, like brings up any questions you may have when you're reviewing the evaluation documentation. If you don't understand something, it will help you make a list of questions. It could also, you know, you could also contact, if your child receives speech and you don't understand something in that evaluation report or in the data about speech therapy, you could reach out to the speech therapist or the occupational therapist or even the teacher, you know, depending upon what your concern is. So, you know, sometimes you can clarify things prior to meetings. So, reasons for collecting data. When you collect data, like we said, the IEP is like a roadmap, and it shows you where the student is and where they are going to be, or where the team wants them to be. You know, your child goes to school to learn. So when you are the parent of a student with a disability, you may ask yourself a lot of different questions, like, how will I know if my student's learning and making progress? You know, as parents, you can answer that question by looking at a variety of different data. This data is important to be collected because it's used in a lot of different ways. So data tells the IEP team members what the student's present level is, and the present level is where the student currently is at. So what are they capable of doing now? What are they able to do right now? You know, what do they struggle with right now? Your present levels are really like where they're at this moment in time. And so it's important to look at that, because if we're going to be monitoring progress of that student, you need to know what their starting point or their baseline is, so that as you gain data, you can tell if they've made progress or not, if the supports that are put in place are helping. And so it's really important to have ongoing data collection that tells the IEP team members how that student is progressing. And you can have conversations about how often that data needs to be collected. Do we need to collect weekly, biweekly, monthly? And all of that can be documented in that IEP. But collecting data really helps you to monitor that student's progress, and it also helps aid in planning, planning for you figured out that student's present levels of performance, but then you're using that data and you're thinking about where you want that student to be in a year's time. So then you have to plan for how do they get from point A, their baseline or present level, to where we want them to be in a year's time. So you have to plan for that IEP for that school year or that year and determine what needs to be put in place. Collecting data is also going to help you look at what services and supports are going to be appropriate for that student. If there are communication difficulties identified in this information or data that you've received, then maybe it's going to be determined that that student needs speech therapy. It really helps you figure out how to move forward, what to put in place to help meet that child's needs moving forward. And I think data really can show you what a student's strengths are and what their deficits or areas of need are. So when you look at evaluation reports, any type of evaluations, test, homework, anything like that, you can see like what does a student excel in? What are they doing well with? But also look at what are the areas of need? Where do they need support, accommodations, services put in place? And when you look at that information, there's ways I think that are helpful for looking at that. So when you're looking at the information with student strengths, student needs, when you keep that in mind, a lot of times when I go through records here at work, I do a lot of record reviews. I might take an IEP and take a look at that and really try to highlight in different colors. I'm going to highlight the student strengths in blue when I go through the IEP. So then those kind of jump out at you when you're taking a look at it. And I might highlight areas of difficulty in green. So then you can take that information and really separate out like what are their areas of need, what were identified in this evaluation, and how can we use that moving forward in writing the IEP. So, the evaluations that are completed or the data that's gained, again, that IEP team's really going to take a look at that and look specifically at what that child needs. Again, if your child's seeing somebody outside of the school, like if you've had an evaluation completed outside of school, some people take their students to like a neuropsychological or evaluator, psychologist, or just a psychologist, or they may get therapies such as occupational therapy, speech therapy, things like that outside of school as well. You can gain data from those places as well and bring that back to the team. That the more data you have, I think the clearer picture it may give. And so we've kind of talked about present levels a little bit, but I think that, there are different questions that you can ask. Sometimes like, okay, what is my child's present level of performance? So some questions you can ask that may help you get a clearer picture of this would be, what is your child's level of academic achievement in like maybe in reading, writing, spelling, or arithmetic? So what grade level or what level of math are they able to do? If they're in second grade, are they doing the same curriculum that's expected of a second grader who doesn't have a disability? Or in reading, if they're in fifth grade, are they reading at a fifth grade level? Where are they compared to a peer who does not have a disability, or the expectations of the fifth grade reading level? And asking at this point in the school year, even where are they expected to be? Where are they expected to be throughout the school year? because you're expecting to build on the level of skills throughout the school year. So if you're halfway through the school year, you could ask, where are they in terms of what's expected of them at this point? So there are a lot of different questions. Again, you can ask, can the child read textbooks assigned to the general education students at their grade level? So if they're in high school biology, are they able to read that textbook the same that's assigned to that class? Or if they're in third grade math, are they able to read that math textbook? You can also ask if your child's reading skills are 2 or 3 years below grade level on an individual education achievement test for reading. You know, you can look at information like that. If you get, like I said, if you get copies of an achievement test that was completed and you don't understand it, you can ask questions. You know, help me look at this piece of data and understand it more. Sometimes data can be hard to interpret, and looking at data, you may ask, like, do I have all the information I need here on that piece of data? Can your child read at grade level or read the grade level textbooks in all core academic subjects? So these are just questions that maybe help you clarify where your student is at. Again, you know, a lot of those questions you can ask specific to one subject if you have concerns, or all subjects. So those are just some things to keep in mind. So once you figure out what areas of need, strengths, and areas of need there are for a student, and that student's found eligible for an IEP, they've been evaluated, found eligible, you're going to write that IEP. Another way to look at data, another way data helps is writing IEP goals. So in the evaluations, you have identified areas of need. And so you can make sure when looking at the IEP or writing the IEP that all areas of need are addressed in that IEP. Some of those needs may be addressed through writing IEP goals. And so your annual goals will list what skill or behavior that a child's going to work on during the school year, and these are going to be written statements in the IEP. Once your child's needs are identified, then the IEP team again works together to write and develop appropriate goals to address those needs. And then an annual goal describes what your child is going to be expected to do or learn within a 12-month period of time. So right now, if you wrote an IEP today on September 25th or 15th, sorry, of 2023, then you would have to rewrite that IEP by September 15th of 2024. So it's good for one calendar year. Again, you can meet more often if needed, but you have to at least update those IEPs annually. So you're really looking at setting goals over the next 12 months when you write an IEP and the goals. You know, goals can be big steps. They're, you know, an example would be like Susie is 6, but evaluation information shows she knows the names of only a few objects. So an annual goal could be for Susie that she'll correctly name 60 new objects, but then you may break down that goal into smaller objectives. So some children, you know, you have an IEP goal, but you're also writing objectives as part of the IEP, and those objectives or those benchmarks are just smaller steps. They break down that annual goal into smaller pieces and give you steps to meet. You know, first, you know, we know that Susie has a goal of naming 60 new objects, but the goal may be broken down into several objectives. So you may have the first objective being by December 31st, Susie will name 20 new objects in her environment. And then the second objective would be by March 15th, Susie will name 20 additional new objectives in her environment. But when you're looking at those objectives, once you hit December 31st, well, you can be gaining or compiling data between when the IEP was written in December 31st for the first objective, and you can look and see is she progressing toward that first objective. And once you get to December 31st, you know, if she hasn't met that, then you need to revisit, you know, do we need to change something about this goal? But again, though, you know, that's a way to gain data. You know, you're breaking it into smaller steps and really looking at, is that student meeting that goal. Data can show you if something's not working, what changes do we need to make to help that child get appropriate services in place and help them reach their goals. So, you want goals to be a SMART goal, and a SMART goal is a goal that's specific, it's measurable, it's attainable, it's going to be realistic and relevant, and it's also going to be timely. And we're going to go into that more in depth. So a SMART goal or a SMART IEP is going to have a specific goal, or goals and objectives. So specific goals are going to target areas of academic achievement and functional performance. So a specific goal is going to include clear descriptions of the knowledge and skills that will be taught, and then how that child's progress will be measured. So on an individual goal, if you have a reading goal, you're going to tell specifically where that child's at, what their present level is, and specifically where you want them to be as a team in a year from now. And you're going to break down how is that progress going to be measured. Are we going to do classroom observations, or are certain assessments going to be used? Who's going to monitor that? On a goal, you're going to have implementers listed on that goal. Who's involved in carrying out that goal and monitoring that progress? So, you may okay, so now we want to talk about measurable goals. And again, a SMART IEP or a specific IEP goal is going to be measurable. And measurable means that you can count it or you can observe it. Measurable goals allow parents and teachers and IEP team members to know how much progress the child has made since the performance was last measured. So with measurable goals, you will know when the child reaches that goal. So there would be no question. When a child is able to do this, then they've met that goal. So we're going to do a little question here. We want to talk about which of the following two goals is measurable. And so the first one is Owen will improve his reading skills. You can type in the chat if you want. I'll monitor that right now, but do you feel like this goal is measurable? And I'll give you just a minute to go ahead and type in the chat. Okay, I am seeing comments in the question box that no, this is not measurable, and questions like what level is he currently at and what level do we want him to achieve. So, okay, the second one is given second grade material, Owen will read a passage of text orally at 110 to 130 words per minute with random errors. What are your thoughts on this goal in comparison to the first one? Do you feel like this one is measurable? Okay, so I'm getting some feedback that this one is much better. This one may not tell us exactly where Owen is currently, but this one is telling us, he's going to be given a second grade material and that he is expected in a year's time to read 110 to 130 words per minute with random errors. And somebody commented they're unfamiliar with random errors. So, again, this brings up a point of communication. If you as a parent or an IEP team member feel like, this goal, it's more specific than the first one, you could ask Can we change the wording of this? Can we put that Owen is currently working at a kindergarten level with materials, and that, you know, currently he's at this level, but we want him to start or build up to a second grade level. And that, you know, what do we mean with random errors? How many errors would he have? You know, random errors, does that mean 2, 5? So those are questions that could be asked in the IEP meeting. Okay, so when you're looking at writing an IEP goal, you also want it to be attainable or include action words. So IEP goals, when you're writing them, you want a direction of behavior. If it's an IEP goal that's involving behavior, students exhibiting behaviors, you want to know, is that behavior going to increase, decrease? Do they need to maintain that? Where are they at? And what are they going to, what's attainable for that student? What's an attainable goal for them in a year's time? So where do we want them at within that year? You want to know what the area of need is. Is it reading, writing? Does the student struggle with social skills? Do they struggle with transitions, communications? You know, what area do they struggle with? So, and then you want to list a level of attainment. To what age level? Do we expect them to do this without assistance? So the SMART goals are going to include action words like the child will be able to do this. So, you know, you could say the child will be able to maintain a conversation, or, you know, and you would want it to be more specific than that. Or they will increase independence on turning in homework. So maybe they're struggling to turn in homework consistently. Maybe on average 2 out of 5 school days they're turning in their homework, but you want to see them in a year's time turn in their homework 5 days a week consistently. So you may start with, you know, making objectives. This is the goal. The goal is for them to turn in their homework consistently for 5 days of the school week, but they're currently only doing it 2. So you could break down objectives that you'll build up to that 5 days. But you want something that's going to be attainable. So an example of a goal would be Betsy will decrease her anger and violation of school rules. And then that one's a little more vague, but then you could go more in detail and say, provided with anger management training and adult support, Betsy will be able to remove herself from environments that cause her to lose control of her behavior so that she has no disciplinary notices. So that would be an example of an attainable goal. And okay, so you also want goals to be realistic and relevant. So realistic and relevant goals and objectives are going to address the child's unique needs that result from the disability that they have. So an example, you know, Kelsey will demonstrate improved writing skills. That's vague. A more detailed and realistic and relevant goal would be that Kelsey will improve her writing and spelling skills so she can write a clear, cohesive, and readable paragraph consisting of at least 3 sentences, including compound and complex sentences that are clearly related. So that's a much more specific goal. So you also want goals to be timely. Again, you know, a goal is time limited. You're writing that IEP for a 12-month period, but you also have objectives that are breaking a goal down into smaller steps. So you want to know, again, what the starting point is. Where is that student when you write? If you're writing an IEP today on September 15th, where is that student at currently? What is their present level of academic achievement and functional performance? time-limited goals are going to enable you to monitor progress at regular intervals. So you're wanting to determine how often progress is going to be monitored for that student in that specific area on that specific goal. So if you assume your child's in like the 4th grade, you could say Alex reading level skills or reading skills are at an early 2nd grade level. So an example goal would be that to talk about what a student could do, the present level of performance, if you say given a 3rd grade reading material, Alex reads 50 to 70 words per minute with 4 to 6 errors. And the annual goal would be given 5th grade material, Alex will read 120 words per minute with only random errors. To ensure that Alex meets this goal, we will measure his progress at 9-week intervals, so 4 times during the school year. And then after 9 weeks, given 3rd grade material, he would read 110 to 120 words per minute with 1 to 3 errors. And then after 18 weeks, given 4th grade material, you would expect that he would be able to read 70 to 100 words per minute with 1 to 3 errors. And you could keep going on and breaking that down. But that's a more timely goal that's telling you exactly when you're going to monitor progress. And data is really going to help you look at, if that student is making that progress or not. There are a lot of different questions you can consider when you're thinking about what does my child need or that student need in order to meet a goal. You could ask, how will the IEP team measure progress? Are we just doing observations? Are we looking at schoolwork, homework, tests, quizzes, different assessments? What tools are going to be used to measure that progress? And then a child's IEP has to include information about how progress toward annual goals will be measured. So the information may be in another part of the IEP, or it could be directly written into the goal statements. Sometimes you will see information on goal statement pages talking about how that progress is going to be monitored, like what format and how frequently. The IEP must include a statement of the school, how the school is going to let you know how your child is doing in school. So that information is going to be shared with you at least as often as parents of children who do not have disabilities are informed of progress of their students. So progress reports are going to describe the progress toward each of the child's goals. And so that's information that you can review and, really review carefully and look over and see how are they doing, like what are their goals, what benchmarks or objectives have we put in place, and how are they making progress or progressing toward that goal. If you have concerns that they're not progressing, you could always ask to amend those goals, revisit those, and look at, are there changes that we can make? If you don't think your child's making enough progress toward a specific IEP goal or more than one, then really there are, like I said, several different things that you can do. You can talk to the special education teacher, you could talk to the principal, reach out to school staff. Don't be afraid to ask questions. And again, you may need an IEP meeting, you may not. Sometimes amendments can be made without a full IEP meeting. You may review that IEP and make changes at any time. You at least have to have meetings annually, but meetings could occur more often. Again, if you're requesting a meeting, the IEP team meeting includes you, and you'd look at that child's progress, look at their goals. Like, if you look at they're not making progress, you could look at, do they need more services? Do those goals need to be changed, revised? Do we need more testing? Sometimes you may come to the conclusion that you need more data or more, testing to be completed to look at what does the student need to reach their goals. But, revisiting that and talking about that would help the IEP team determine how to move forward to improve that student's progress. Have more questions that you could possibly consider. So, you could also ask, what is the relationship between the goal that's written and what's the purpose and the purpose of IDEA, which is to prepare your child for further education. You know, an IEP and things like that are to help put things in place to prepare your child for the future, for further education, employment, independent living. So what is the relationship between the goal and the purpose of the service? What are your child's areas of need? Again, we said you can look at evaluations and all sorts of different data to determine what are my child's areas of need. And how do these areas of need relate to that child's disability? That can be helpful, or those are questions that are helpful to lead discussions and really help you look at data and think about these questions when you're looking at data to prepare for an IEP meeting. You can also ask, how do these areas of need affect your child's progress in the general education setting or the curriculum? You know, are there certain supports that could be put in place to help them access the general education curriculum? You could also ask, what does your child need to know or be able to do as a result of the IEP? Some other questions to consider asking would be, what is it about the child's disability that's interfering with their achievement or their knowledge of a skill, achieving a certain skill? What is the measurable starting point for this knowledge or skill? So you can look at where your child is at currently, but you can also look at what is a measurable starting point. What's kind of, if you're supposed to have certain knowledge or a skill, what is kind of the starting point to start getting that skill or mastering that or working toward achieving that skill? How will you know if your child is learning this knowledge or skill? That's another question you can ask. That may be a question that helps drive what kind of data needs to be collected. And then you could ask questions. What am I going to see my student or child doing when they reach that goal? Also, what effect will reaching the goal have on your child's learning? And how can that knowledge or skill be measured? So there are a lot of different questions that can be asked to help you strike up conversation and drive what type of data needs to be measured. So that brings us to the end of the information I have. I wanted to leave some time for questions, comments. If you have any questions, don't hesitate to put those in the question mark, or in the question box, sorry. I do appreciate you taking time to join us today. So if you have any questions, write those in. Again, if you want to talk to somebody more specifically about your child's specific situation, don't hesitate to reach out. I will move forward. Our contact information, again, is on this website, our toll-free number, our website, and also I've left the link for our Facebook. You can message us through that as well. So I'll just give you a minute to go ahead and type in any questions. Do have a question, how are minutes calculated for services? This is something, I will look into this and make sure I get you specific information, and I can get back to you on that one because I don't have that exact information on the top of my head right now, but I can look into that and get back to you. I'll just give it a minute for any more questions, and then okay, I'm not seeing any more come in, but like I said, don't hesitate to reach out to our office. We're happy to help you. I appreciate your time today. Just keep, checking your email, refer to our Facebook page if you want information on upcoming trainings. We look forward to seeing you in the future. Thank you.